All right, we're going to go ahead and get started. So again, thank you for joining us today. I am Amber Freeman, the Training and Technical Assistance Coordinator for CCEH, and today you are joining the webinar, Components of an Effective Outreach System. So before we actually go into the webinar, there's some housekeeping I want to go over. So because this is a webinar, you all are all muted, but you can input your questions in the question box, and I'll be sure to go over your questions at our question and answer segment at the end of the webinar. Also, this webinar is being recorded, and we'll send out a link to everyone who registered at a later date. For this webinar, we would like to make it as interactive as possible, so there are certain parts during the webinar where we're asking you all to give us your feedback. So you can input your input in the chat box, which is on the right side when we get to that part. So for today's webinar, I have my colleagues from CCEH joining us. We have Carl Askakanen, who is a Youth Systems Coordinator. We have Tajmia Bryant, who is a Capacity Building and Equity Program Manager, as well as David Gonzalez Rice, who is our Senior Program Manager. So for today's webinar, we're going to give the vision and framework for coordinated outreach. We're going to speak a little bit about effective outreach practices, as well as go into more detail and talk about how outreach is collaborative and how to have a tailored approach to outreach. This is our first outreach webinar of a series, so there will be more to come. But today we are just going to set the framework down and speak to it on a higher level. So we're going to get started. First, we have David, who is going to go over the vision and framework for coordinated outreach.
All right, thanks, Amber. Good morning, everybody. So I want to start by acknowledging there's a lot of input from community partners into this vision. So in the fall and winter 2019 into 2020, I worked with Brenda Earl at Demas and a number of outreach providers and CAN outreach coordinators and others visited many of the CANs, community care team meetings, housing matching meetings, CAN operations meetings, just really trying to take the pulse of what outreach looks like in Connecticut. And then as well, reaching out to communities around the country, looking at research and talking to outreach providers elsewhere around the country to see what it could look like and how it might look different from how things have worked in Connecticut so far. So, in addition to today's presentation, we'll be sending around some documents that came out of that work. So please watch for that. They'll give you the opportunity to go into a lot more detail than I can on the slides. And I'd be happy to talk to anybody about those materials in more detail as a follow-up. But for now, I'd like to just kick off with this question: what do we mean when we're talking about homeless outreach? I think many of us experience that in practice, we have different expectations and different understandings of what that is. I just listed out here 6 different examples that came to mind from my experience working and visiting communities of things that sometimes are described as homeless outreach, right? Healthcare worker who leaves their office and goes over to the shelter to provide healthcare there. Drop-in office hour appointments at a mental health authority or other provider that are meant to reduce barriers to access. Distribution of socks and supplies out on the street by volunteers or staff who have other job descriptions. In some CANs, I've been aware of staff who look through the appointment schedule ahead of time and call people up even before everything went phone-based, or trolled through the no-show lists looking for especially youth to reach out to and ask why they hadn't been able to make it to the appointment. I've heard about business owners who know people living in their parking lots who call 211 and engage. And this example of library staff actually comes from Middletown, where I was able to visit a PATH worker who was using sort of regular office hours at the Middletown Library as a way to reach people. So I'd like to invite you to do in the chat box is just a list you know, from 1 through 6, out of that group, which are the things that strike you as being most, you know, falling under the heading of outreach? When you talk about homeless outreach, what would you include there? Just to get a quick poll, running poll, if you'll drop that in the chat box. If you like to also, you know, provide a phrase or a sentence to, you know, describe what you're thinking. We could do that now, and I'll just take a minute. I'll be watching your responses as they come in. And Amber, I think I need you to give me ability to advance the slide deck.
You should be all set.
There we go. Thanks. There we go. Just making sure this is working. Okay, I've just got a little lag, but we're working. Okay, I don't see anything coming through yet, but the point I want to make is that, you know, when we talk to our community partners, to staff at other agencies, people who work in other sectors, we do have these different understandings. And what's common across initiatives that could be described as homeless outreach is that they share a handful of traits. They are sort of flexible approaches to trying to reach underserved people. They are proactive efforts. They are assertive, right? So basically, rather than having a standing site and an appointment that a person has to make, you have some sort of flexible capacity to go out looking for people, or in the phrase that we're all familiar with, meeting them where they are at. Amber, my keys again aren't, there we go. So these are just some of the ways that you could characterize homeless outreach. Now, although all of these things could be called homeless outreach fairly, that's not the same thing as them being coordinated and effective, right, at certain outcomes, like reducing homelessness, ensuring that people experiencing homelessness are connected to services, being able to see progress or sliding back on progress, right? All of those kinds of activities could be getting done and could be good work in and of themselves. But what we're really trying to focus in on here is how do you take those different pieces and put them together in a way that promotes sort of effective movement towards specific goals for homeless outreach. So one way to think about what's at stake here, I mean, homeless outreach is not only about people who are experiencing unsheltered homelessness. You can have outreach from a medical provider to people who are staying in a shelter. You can have outreach from school staff to unstably housed youth. But the case of the unsheltered population, which has really been the focus of my work, and Carl will speak more to some other vulnerable populations, is that unsheltered homelessness is this particularly acute crisis for people who are experiencing it. So I just wanted to make you aware that the source here in the link below is the California Policy Lab has done an analysis of tens of thousands of VI SPDAT responses from 15 states. They were supplied by OrgCode. Matt Doherty of USICH has been part of analyzing this data. And what they found is, nationally, there's some really stark differences between the unsheltered population and the sheltered population. So people who, in this large sample of VI SPDATs, reported that they were experiencing unsheltered homelessness were 8 times as likely as their sheltered peers to report that they had been homeless for more than 3 years. Were 25 times as likely as their sheltered peers to report that they had all 3, chronic health, substance use, and mental health conditions concurrently, and were 10 times more likely to report a recent police or emergency contact. Something that really stands out in the data is the experience of unsheltered women, who are twice as likely as sheltered women or homeless men in general to report abuse or trauma as the proximate cause of the homelessness they're currently experiencing. There's an impact of this over time as well, that in this large survey sample, people who are in an early period in their experience of homelessness, that in that group, people who are sheltered start out experiencing more mental health difficulties, and people who are unsheltered report fewer, but that pretty quickly over a few months, the population experiencing unsheltered homelessness reports increasing rates of serious mental health conditions, so that even just in what people are sharing in response to an assessment, you can see this strong correlation over time of people experiencing worse and worse health conditions as unsheltered homelessness continues. And for all of these reasons, of course, we know people are also services disconnected, face additional barriers in accessing the services that are available. We really have a mandate as a community to seek out this population because of the intrinsic vulnerability that they're experiencing, and also because the very nature of their circumstances make it harder for them to access even the low barrier design of appointments, hotlines, and so on that we have in place. One community I talked to that was really striking was in Montgomery County, which is a suburb in north of Philly. You know, another thing that's at stake in effective homeless outreach is understanding just how many people are out there, because when our state partners, municipal partners, other funders are making judgments about what's needed, it's important to take an accurate snapshot of the need. And what I heard in communities across the country, and you'll hear in any panel on homeless outreach at National Alliance to End Homelessness or a conference, is that it's the people who are living outdoors who are least likely to show up in our data and in HMIS. But there's this tricky thing when you're identifying more people, but don't also have more resources in hand right now to start serving them. So I've sometimes had providers ask, as we were doing this work, well, what's the good of finding so many more people and just getting their names on a list if we don't have the resources to serve them? Which is a fair question, and is a real challenge. But this perspective from the Montgomery County Coordinated Street Outreach Team was really enlightening to me. Their county is about a quarter of the population of our entire state of Connecticut, so they're covering a pretty large population. And they've been adopting this coordinated countywide approach to homeless outreach just for the last couple of years. And what they had to say is, look, we started out doing this, we found a lot more people than we expected, and we ramped up to try to make sure that we could find everybody. And we know we don't have the resources. Our shelter wait list is 6 months long. We don't have enough rapid rehousing. We're doing these self-resolution, problem-solving conversations in the field, but this is the underlined piece here. We felt we needed to widen the front door and identify everyone so we can be honest about what it really takes to end homelessness in our community. So having that knowledge and being able to turn that around into advocacy and planning for the resources that are necessary, I think is another piece that's really at stake in ensuring a coordinated and effective approach to outreach. So Connecticut's distinct in a couple of ways. So a lot of the places where a coordinated approach with lots of partners at the table and good data are happening are not statewide efforts. They're happening in urban areas or in large cities. Montgomery, you know, as a suburb of Philly is a little bit of an exception there, but where the visibility and the density of a population experiencing unsheltered homelessness really drive a city or a county to make a significant investment. Connecticut is a little different. We have areas that are like that, but we try to build a statewide system. And we have some strengths that are unique to us that we bring into this. Our unsheltered numbers in the PIT count and by other metrics that we have available are relatively low, especially in a national trend where unsheltered homelessness has been climbing in the PIT count year on year since 2016. And Connecticut has held steady or seen a decrease since 2016, you know, against all trends. We know the limits of the PIT count. It's a one time a year thing. nevertheless, in the national context, that's really striking. We do have this robust infrastructure of 2-on-1 in the cans that we can build on. It strikes me that when I talk to people in the cans who are at operations meetings, at matching meetings, people understand unsheltered homelessness and care a lot about it and want to find solutions. We don't have to convince our homeless response system that this should be a priority. People are on board in spirit. And then DEMIS has made PATH available statewide. This is something I always impress on people talking about homeless outreach in Connecticut. That PATH is not a resource that's allocated to homeless outreach in every state. In a lot of communities, it's just not doing that role at all. So we've been fortunate in Connecticut to have PATH dedicated in this way. On the other hand, we've sometimes gotten into a habit of thinking, well, that's our homeless outreach and we're looking to them to do it. And we use our other resources for other things. So I just want us to be mindful that we can't sort of rest on our laurels with the good fortune we've had to have PATH be available in this way. And we really do need to think about how to supplement it. You can hear my son's music in the background. Let's see. We have specific challenges in Connecticut. So we know that some populations are much less likely or able to call 2-on-1, or that if they do, their no-show rates for a CAN appointment are a lot higher. People who tell 2-on-1, I'm in a place not fit for habitation, are really unlikely to show up for a face-to-face appointment relative to their peers. Some changes in that picture recently that we'll talk about at the end. We have a lot of communities that are not covered by canvassing efforts, where we just don't have a presence of a street outreach team. Our data, for various reasons, which include ways in which our HMIS is not as convenient or user-friendly as it could be for this purpose, mean that our data on homeless outreach is less reliable for unsheltered homelessness than it is for the sheltered population. And then the process of how 2-on-1, the CAN, and outreach teams interact with each other looks pretty different can to can. And very often there's not a direct line from one to the other. There's some kind of meeting or informal local process that mediates how outreach gets deployed or referred to. And that's something that stands out as different from some of the communities we looked at elsewhere in the country. So by comparison, a lot of the communities elsewhere have municipal government is invested and committed to homeless outreach in a different way. We know Connecticut's this interesting place where there are no counties and the towns kind of slug it out directly at the state legislature. So we have our DEMIS regions, DEMIS regions, CAN regions, and that's just a unique thing about Connecticut. Lots of the other communities doing coordinated outreach really focus on multidisciplinary teams. So rather than, 1, 1.5, 2 outreach workers who have a similar job description, the emphasis is on a half a dozen people who have clinical credentials or are certified peers or are specifically benefits navigators or other kinds of specialists who support one another and can be deployed according to their expertise. And that's not a way that we've tended to organize outreach teams in Connecticut. We tend to see it more as one kind of a job description. The use of real-time data is stronger in some of these communities. Los Angeles really stands out here with a portal they call LA Hop. And then there are more kind of focused intentional strategies to widen the front door to identify as many people as possible. So the equivalent of 2-on-1 might be able to deploy outreach workers directly. That's something that we saw in a couple of communities, and also options for community partners or the public at large to report what they're observing about unsheltered homelessness or encampments through a centralized portal. So I'll pause here and give you an opportunity again in the chat box. And Amber, I'm not sure if I just can't see participants' entries in the chat box or if it's just a quiet group on a Friday morning, which I would understand.
Some individuals were putting it in the questions box. So if you guys can put it in the chat box, it's right. It's one of the last labels on the right side of the screen.
Okay, so I'll take a pause and take a sip of water while you're thinking about what you think makes up an effective outreach system. And then we'll continue through to talk about some of the things that the working groups I collaborated with found. And Amber, if you want to just alert me to anything that's in the question box, I don't think I can see that, or at least I'm not familiar enough with GoToMeeting enough to find it. But maybe at the end we can synthesize some of those things and ask people who responded to elaborate in our Q&A.
Okay, so we have a few people that inputted information. Someone said they think an important component is keeping in contact with clients, also commitment, organization, and resources. Have a coordinated system between providers, emergency personnel. Let's see, we have a lot of good answers. Promoting services and engaging clients.
Emergency personnel is an interesting one we'll get into further here, because we know that in a lot of communities, and Connecticut's no exception, that often the entity that's interacting most often with people experiencing unsheltered homelessness is emergency services or law enforcement. And I know one community in Connecticut where, state troopers are in some ways the eyes and ears of the one outreach worker who relies on them, to tell them where and when to go to try to find people. So that's a really important note. Lots of good input there. And I think you'll find some of those perspectives reflected in what I'm going to share here shortly, and what's in the documents we'll be sending around after this webinar. So let's see if I can advance my slide. There we go. So roles and functions. Oh, oops. I've got enough of a lag that I'm double clicking. Amber, if you'll navigate me back to that slide that says roles and functions, I'll just start describing that. So one recommendation that I would make to anybody who's thinking about how to staff up and organize outreach in your community is to set aside, at least temporarily, thinking about it as a job description that 1 or 6 people do, and think about what are the tasks that need to get done. So got lengthy breakouts of these in a document about outreach roles and functions, but just to quickly characterize them here. One crucial role is just identifying who is out there. And I'm always a little iffy about this word identification, because I was really impressed by how some communities are looking at physical descriptions of people, GPS coordinates. If you can't get a name, you have some kind of point of information about a person or a place that sets a cue to try to work through and to try to figure out who that person is and what their needs are. So for this function of outreach, you want the broadest catchment possible, right? We're not thinking here about what we can verify, what a COC-funded housing project could take today. At this stage, we're trying to just set the door, the catchment as wide as we can. This is the inclusive aspect of outreach. And as I said, to set a kind of a queue or roster to work through in follow-up. How do we follow up these community reports and then determine, is this something that needs follow-up, or we weren't really able to see anything here. So that's one outreach role, but that does not have to necessarily be done by an outreach worker, right? Lots of community partners who could have hands in that. A mobile CAN appointment, thinking about how our system works here in Connecticut, ideally for a person who is unable to attend a CAN appointment at the location or in the way that they're structured because of structural barriers or symptoms that that person experiences or what have you. Ideally, we would have the ability to bring the full toolkit of that appointment to that person where they are, right? Not only the, the sort of HMIS intake fields, but whatever diversion dollars or shelter prioritization is available at the standard CAN appointment should in theory be available in a mobile version that's delivered, whether that's by a dedicated outreach worker or a CAN navigator or anybody who has that capacity in the way that their job is structured to go back. Our experiment right now with phone-based CAN appointments is actually a really interesting implementation of this idea that just swept over us whether we were ready for it or not. So I'm really curious to learn how that goes in meeting this this need. Any of you that's been doing homeless outreach knows the CANs and the housing providers want you to get those verifications done. So there's a lot of work here. And I'll just flag that there are different standards of verification depending on the resource type. And that in some CANs, depending on the ratio of demand to supply of shelter beds, even a verification for shelter access has been put into place in some CANs. So this is something that outreach workers are often tasked with doing, but can be done by a number of different job descriptions, not only by a dedicated outreach worker. Responding to crises or requests from the community as they come up. I think many outreach programs feel when the mayor calls us up or when the police officer reaches out, or when we hear from this or that community partner, we want to be able to show up. And that does really seem to be a crucial role that people look to outreach to do. Assertive engagement. This comes up in what you all shared in the chat about how you understand outreach. This is often at the core of how outreach workers see themselves. We keep showing up and offering, right, until somebody's ready. And I think not only housing that function within a dedicated outreach worker, but figuring out how to infuse that approach further through the CAN or larger systems of delivery is important to reaching underserved populations. And then finally, case management and services coordination. Some of our outreach projects, depending on their funding or how work is organized locally, are expected to carry a caseload and have like a target for positive exits and housing placements. So one way to think about this is that the top 3 of these roles and the bottom 3 of these roles are like more or less labor intensive and more or less specialized work. So one way to think about your planning would be, we have a massive need for identification, but how can we ensure that our skilled, specialized, have been doing this job for years, outreach workers are able to do those last 2 pieces of engagement and case management and really, focus their skills and their relationships there? Who else can we bring to bear to help us do the initial identification, the verifications, and divide this labor up in different ways? One of the documents that we'll send around is this big old spreadsheet with a lot of different potential partners listed on one side, and then all these different roles and functions on the other. And it's just it's an exercise. It's not, it's not like correct. It's not the only way to think about it, but just an exercise in thinking about who within your community could perform all of those different functions. And then with some of those community partners in Connecticut, want to call out Alexis Gaynor at Journey Home, Caroline Perez at Columbus House, Brenda Earle at Demas again, Lori Walling at CHD. A handful of outreach providers have been doing this work for a while, who sat down together and really tried to spell out what would characterize a good outreach system. So again, these are broken out further in the document that will go around after, but just want to flag for you all that taking a look at, what should the outcomes be? What would characterize a quality outreach system is an important exercise. Associated with this is a USICH document called Components of Effective Outreach that also describes a lot of the traits and qualities of a strong outreach system. So we can get further into this in future webinars. Again, there's documents that dive further into this idea, and which we could move forward into a community self-assessment tool or checklist. But just want to let you know that it's there. And I know my fellow panelists are going to speak to some of these ideas about being trauma-informed and working through an equity lens. Have to acknowledge that the current circumstance, has changed everything. Homeless outreach and unsheltered homelessness are no different. We know that the experience of unsheltered homelessness has changed with less access to community-based resources and spaces like libraries or a place to charge your cell phone. On the other hand, we're experiencing a change in how CAN appointments are conducted that seems to be reaching people better. So we've taken a look, and we know that for individuals calling 211 and scheduling a CAN appointment, the number of people calling is held steady, but the no-shows have dropped. So you're all talking to more people, reaching more people. Whether that's amounting to reaching unsheltered people more effectively and serving them is sort of an open question, but there is this change in the way the CAN appointment's getting delivered that seems to have the ability to reach more people. There have been increased investments in certain kinds of funds to be available to individuals without children, which of course is the group that's more likely to be unsheltered. And then we're all thinking ahead to cold weather. Like, we don't know what those winter overflow spaces are going to look like in this context. I know Carl will be speaking as well to the challenges of identifying students experiencing homelessness in the context of school. So I just felt it was important to acknowledge all this, research and looking around in the fall and the winter. It's a whole new world already, right? So really just want to acknowledge the crucial role outreach could be playing here in the coming months, and let you know that CCH is here to try to think through that with you all and troubleshoot and problem solve. So I'll leave it there, and back to you, Amber.
Great. Thank you, David, for laying down the foundation and just giving us some more information on outreach. There's definitely more to come. For the sake of time, I am going to hand it over to Carl, who is going to speak more to the collaboration that's involved with outreach. It's all yours, Carl.
Awesome. Hey, thank you. So welcome. Thanks, DGR, Amber, and Mia, and everybody here this morning. Glad to be part of this. Just would say, David talked about the context, the roles of outreach, some systemic goals, certainly. Collaboration really is about building the support of the component parts that go into an effective system. So that's what I'm going to speak to. And then I would also just say, not every partner that we bring up, certainly, and David alluded to this too, is really going to have an outreach worker tied to it. But we really want a system where all of the partners, collaborators are engaged in the work of identification and resourced up and knowing about coordinated access and really know about the scope of partners that are available in this system. So I just wanted to say that kind of preemptively. We realize outreach, there's not a lot of outreach workers at the moment, and we can't have outreach workers in every single entity where we might otherwise want them. But we have to think really creatively about how we're engaging with institutions and organizations and leaders around us to make the system as strong as possible. here's what I would say is that, we assume, the CAN partners and the coordinated access network partners and the youth dedicated folks are vital, but we are hoping that you're all working together and know the scope of each of your individual works. So, but CAN is really only the surface in building this system that's complex and has a really strong foundation. So, yeah, we're looking for strength in numbers and increasing networks, and a lot of this it's very labor-intensive work. For those of you who do community-based work and direct service work or community organizing, frankly, is really what this is about. It's about uncovering allies and partners in obvious places and then not so obvious places. So I would just say the work in communities to address homelessness, it means really engaging on multiple levels of partners and with these different types of stakeholders. And so David went into this a little bit, but I just would point out that, you know, outreach as it is now, and as some of you who are listening in have these really strong partners with perhaps the Department of Transportation. A couple weeks ago on the Learning Collaborative for the Youth Navigators and the YHDP program, we talked about parking enforcement in some towns as being also a navigator ally to, you know, who else knows clearer about who's sleeping in their cars in some urban areas. It was an ally that we utilized when I was doing this work in Philadelphia. Certainly police, business owners, nonprofits, for-profit businesses, absolutely. For our partners in youth service bureaus, which occur, these, you know, bureaus are almost in every town in the state. They specifically serve youth. The partners that we want to see there that could aid in this quick identification are the McKinney-Vento liaisons that are from school districts. They're clinicians from local providers and LMHAs. They could be teachers from the local school that also sits on the juvenile review board at the Youth Service Bureau, right? So there's different levels and types of staff that are engaged. And the navigators that I alluded to from the YHDP program, they have close contacts with shelter staff, with healthcare providers, and with municipal staff. And I'll get more into schools later, but just trying to like lay down a little bit about this vision about who are important in networks and the breadth of the networks we should be thinking about. You know, schools have a lot of challenges before them already and often operate in isolation from resources. But they have McKinney-Ventos who are supposed to level the terrain for homeless or doubled up families and individuals. They have guidance counselors. They might use an outreach worker to help work with a family that they know is in shelter. They might also utilize town level social service agents. There's not a lot of those around. And they should have and really could have contacts with runaway homeless youth providers. Again, not many of those in the state, but when there's one around a school district, or if you're struggling as a school district to know who to outreach to, we should have all of these partners as part of our network so that we can build a quicker response and get resources, referrals, et cetera, to families and young people who are struggling. So the next slide is about kind of working towards a plan. Right now, statewide, with the youth engagement team initiatives, with the Yetis, the youth dedicated collaborators we have statewide, we're really looking at what are the gaps and what are the resources that we have right now for helping identify young people in towns all over. And this is about like an assessment of what the system is like. So we want to be able to really talk openly about gaps in resources, and then resources that we do have, part of the collaboration piece is about how we utilize those resources and the timing of that. And when is staff looking for young people, and where are they looking for them? And kind of around the clock, in the morning, later. This speaks to like some of the practices of individual outreach workers. We also want to be mindful of the goal of really addressing geography in the state as comprehensive as possible. One of the goals and benchmarks from usage is to, make sure that we're reaching Salisbury and that we're reaching New London and Fairfield and, up here in the cultural mecca of my town, that's Eastford, Connecticut, that well. So how are we addressing both rural, urban areas and the spaces in between? And then Mia will go into a little bit of this, and I'll speak quickly to some of the youth population, but how are we addressing special populations, people with disabilities, pregnant and parenting, young people and others, right? Those who are most marginalized, people of color who tend to utilize the system the most, and populations that we're just not seeing or realizing, like those who might be outside in rural areas or in encampments. And then working towards a plan also means, realizing your partners and who might allies be, but then also looking closely at other plans that agencies and partner organizations have created along the same line, like looking as a community assessment about what's in front of you, what are strategies that we can utilize to target gaps in these resources. So PATH has a process where they create and submit community plans for their funding. Reentry collaboratives around the state also have done these really robust community assessments and have created plans about how they're going to engage. I know Head Starts for preschool and young folks or young children also have community plans. So think as we're building partnerships and as we're building networks, what are these other partners that have been thinking along the same lines about how can we strengthen our connections to allies doing similar work and working towards a similar goal? Be mindful of time, but we'll go to the next slide. So I'll say a little bit about two events that we have that really rely on outreach. And as the youth system coordinator, I do an awful lot of work with the youth outreach and count. In these two events, the point in time count that is conducted in January and the youth outreach and count that typically follows right after that are these snapshots of data they create these snapshots of data from this particular moment of engagement and outreach. And we rely on targeting for the point in time count from input from outreach workers and from direct service providers throughout the state. And this is always something that needs to get better and can get better, but it should be part of that process. And the same with the youth outreach and count. It's a little bit different. We do surveys over a week. We don't necessarily target only homeless youth or unstably housed youth, but we do focus, but we also target youth in general. And we work through schools and park and rec, and certainly utilizing street outreach and youth service bureaus. And I bring up both of these events. They're vital. They happen really quickly. They provide this invaluable data for the state of Connecticut about where what the trajectory is for homelessness and how services are offered. And we rely on a great big scope of partners, and they're really organizing partners to help us along with volunteers. But I would just say, to build this capacity it's not only for the events themselves, but we at CCH really want to stress that the partnerships that you create for the youth count and for PIT, these are things that we should be flexing as communities year round. And really the PIT and the youth count are just they're frankly moments where we get to really focus those resources, but otherwise a lot of you out there are spending a lot of time building the connections for these networks, strengthening them throughout the entirety of the year. And that's what we're trying to get to, where we have partners we can rely on, not only for that week in January or that day in January, but that we have established contacts with throughout the year. So the next slide, thank you. So now, DGR, David mentioned this as well, like COVID is here, and with schools in particular, we're really, the dynamic way that schools are going to open presents particular challenges. It was already difficult to identify students and families struggling with homelessness within school settings and link them with resources, but this is this kind of new moment. So how is it that we're going to make sure, and how are we all making sure collectively that we're identifying all of the unaccompanied youth that are connected to or not connected to schools now in this fall? Like, how are we going to do that remotely? And, you know, we have some plans and tactics, but not all of the answers. Think about the different ways that your school district or schools around you are going to offer learning opportunities. Are there, or offer resources like through school lunch programs, etc. We don't just need to rely on school staff or put the total burden on school staff, but we also need to make sure that can know about these struggles, and youth navigators know about the struggles that families might be having, and our partners, frankly, at the state level, at the State Department of Education, kind of in coordination. And there's been an awful lot of thought about this and planning, but until we see what September brings and the different ways that these districts are maintaining, connecting kids with learning environments, we'll learn then. So some of those partners are, you know, federally qualified health centers, strengthening the roles of youth service bureaus, strengthening the contacts that we might have with runaway homeless youth providers, contacts with regional DCF offices and the Department of Correction, probation and parole for young offenders, really working in partnership with food providers, not only the school lunch programs through schools and the way emergency food might be provided at schools, but also through the Connecticut Food Bank and Food Share. And then just thinking about YM and YWCAs and other youth serving organizations, like we need all of these folks to be on board as allies and to be trained up at a particular level for us to be able to identify quickly and resource up as quickly as possible young people who are struggling here. So I wanted to say really important, and it's the outreach work and the network building work is like you're carrying an awful lot of water for all of us and for young people and those who are unsheltered. And it's vital that we just keep this up. So I think that's all I had to say, but thank you.
Thank you, Carl. As you said, outreach is so important and it can't be done alone. So building those partnerships and that strong network is very important to make sure that everyone is, you know, receiving the services and support that they need. So with keeping everything going, I'm going to hand it over to Mia Bryant, who is going to take it a step further and talk about how to have a tailored approach to outreach.
Thank you so much for that, Amber, and thank you, Carl and DGR, for teeing up some of the conversation that I'm going to be presenting today, which is about tailoring your outreach strategy. So similar to what Carl was just expressing about the importance of partnership, the importance of collaboration, we want to be thinking about those who are primarily or disproportionately affected by homelessness, and those who may not come into the system, we're somehow missing these folks. And so just wanted to give you some ideas of how you can tailor and target your outreach strategy. So first, I want to start off with targeting cultural organizations. So thinking about organizations that primarily serve specific demographics. Some organizations are tailored towards serving the Puerto Rican community, the Polish community. I know in Harvard, I grew up in Harvard, and we have several cultural organizations, especially I'm thinking about on like the south end of Harvard, where it tailors to the Brazilian community, you know, specific organizations that have these relationships and have this trust and respect from the community, and oftentimes it may be family members that are running it. So thinking about how we can engage those cultural organizations to ensure that people have the information that we need, and thinking that they need to get served if they're experiencing homelessness. Also thinking about the fact that they may speak the language, you know, they may be working with people who, you know, are non-English speaking or just are from a different cultural background where they may not really understand our system and processes and what resources are available. So reaching those community organizations, those cultural organizations could be a way in to really be able to reach those populations that we aren't reaching. Also, various faith-based organizations. So thinking about mosques and temples, synagogues, churches, of course, can be great partners to be able to do those same things that I just referred to in terms of reaching those who may not think to contact 211 or know to contact 211, trust contacting 211 or talking to an outreach worker. Community hubs. So I got really creative with this one because I'm thinking about restaurants and local grocery stores. Oftentimes, you know, there are restaurants that are family run and people go there to congregate to talk. They may talk about what's going on with themselves, and restaurant owners and workers could be great resources to say, hey, you know, I have a family that, you know, I heard of a family, we know a family that comes here pretty often. We've been helping them out with some food. You know, are there any resources available for them? So even thinking about, like I said, restaurants and local grocery stores, local, you know, sea towns that serve the Spanish speaking community. Also places like community hubs like the Artist Collective in Harvard that serve primarily Black and Brown youth. They may have those relationships and encounter youth who are experiencing homelessness or need some type of help, some type of instability they're experiencing. They can be great resources. Boys and Girls Clubs are also a hub as well. And we don't really need to we can figure out how we can tap into these networks that already exist so that we can expand our ability to reach communities that frankly we can do a better job in reaching, or we aren't reaching at all. And this will help us to reach undocumented community who may be afraid to enter the system and scared to ask for help and call 211 for fear of being deported. Non-English speaking communities, especially those who are also non-Spanish. I think we do a relatively decent job with making sure we have Spanish speaking providers that can assist, as well as English, of course. But what about other languages, other demographics and communities that we are not, you know, that maybe don't have a huge population, and so we may not have a staff member that can speak that language. These community organizations are more likely to have that resource available, those people available who can communicate with the folks that you know are non-English speaking, that we don't have that support for. Also, BIPOC. Get familiar with this term if you are not familiar. So BIPOC stands for Black, Indigenous, and other people of color. We know that BIPOC are disproportionately experiencing homelessness. And so we want to ensure that we are able to really reach BIPOC communities so that we can understand, connect with, and frankly, just end their homelessness, ultimately end their experiences of homelessness. And then non-traditional clients, and I threw in the kind of quotations because there's some people who may not enter the system, may have some significant mental health issues, or just misunderstanding or understanding of what the system is and maybe scared. So there's some people that, you know, we may be missing because they, they're falling through the cracks in some way. They're not going to be the people who call 211. So outreach, thinking about how we can utilize these connections and target these types of organizations to reach those folks who may not call 211. Next slide. So we also want to tailor our outreach approach. So when we are in communication with these organizations, these folks from these backgrounds that we, that may fall through the cracks, that there may be some a longer process of building that trust and understanding and being able to get to the point of where we're really able to assist them. Using these approaches can help us to achieve some great outcomes. So approaches like being trauma informed and realizing that there's so many different types of trauma, including racialized trauma. There are experiences that people go through just off of the strength of their race, just for the simple fact that they are Black, a BIPOC. Also client-driven, client-centered, being very focused on what the needs of that person is, are understanding, what their wants are, what their experiences have been, and allowing them to really show and lead the way towards a solution that is ending their homelessness, having them come up with that plan. Also, being collaborative. So I spoke about it on the last slide, but working with community organizers, cultural organizations, they can help with identification. We spoke earlier about low capacity. I think David referred to this, low capacity sometimes, and needing additional coverage of certain areas. Working with these organizations can help with some of the identification and helping you to build a larger network. Also, David mentioned that some people don't have phones to call 211. They don't have the access. So these community organizations can also help with that as well, providing resources to be able to get in contact with you all. And also motivational interviewing, that centers back to really being, client-centered, client-driven, building that trust, and helping them to come up with their own solutions and be motivated to actually, fall through on whatever their plan is. And then harm reduction. So being able to provide support for that person, assistance and resources for that person until they're non-judgmental, until they're able and ready to be able to accept services, or until resources are available. You want to make sure that they are safe and they have basic necessities and resources, which again you can connect with so many of your partners that I mentioned, that Carl mentioned, to be able to support their needs in the meantime and make sure that they are safe and still respecting their power of choice, which is also part of being trauma informed. This will help you to achieve an outreach system and program that has a sense of cultural humility, having that person lead the way because you have a sense of humility to understand that you don't understand everything. There's a lot of things that you don't know that this person knows. They are the expert of their lives. And so it'll help you to achieve that cultural humility. Cultural appropriate services that are tailored and molded around that demographic, that specific person, and doing so in a way that gives you the capacity to be able to do it. Because you can't always, make a policy for this or make a protocol for this, but being able to, knowing that you're being client-centered and client-driven and you're working with the community will help you already do those things, be culturally appropriate and molded around the client. And also sustainable. It's sustainable because it works for that person. They came up with their solution. They are motivated to follow through on, whatever the plan is. They have the trust built in, whether that's specific trust for you and your system and your program, or those community organizations. They trust so-and-so from the YMCA or from the Boys and Girls Club, and they referred you, so they feel like they can trust you. And that contributes to a more sustainable solution for that person because they believe in it and they trust that it's going to work. And that just leads to my last point, which is just that client-provider trust. Trust is extremely important because that person needs to understand that you're there to help them. You have to actually be there to help them, and not in a way where you think that you're helping, but you're actually hurting them in a sense. But that trust really needs to truly be there. And this client-driven approach, this community approach will help you to reach that point. And especially for those who may not enter the system and may not be being touched them in any way. So thank you so much. I'll end there and I'll hand it back over to Amber.
All right, thank you so much, Mia. As you said, outreach, it looks very different for everyone. You know, it's not a one size fits all. Outreach is very different for everyone. And you just have to think outside of the box in order to capture everyone and work with everyone. So for the sake of time, I'm going to move on to our resources. We will be having questions and answers right after this. So if you guys can input your questions shortly, that will be great. So for resources, we wanted to give you all some resources. I know we went over tons of information, and we want to continue to help and support and provide you with additional resources. So the National Alliance to End Homelessness has a good amount of information on outreach. Also, CT Boss has trainings. I know Housing Innovations recently did a good amount of training specifically on outreach. And if you go to the training website there, you'll be able to see all of the recorded webinars. CT Boss also has resources where there's different templates for our outreach plan. If you would like to create your outreach plan, there's different resources on the different components and other things to consider. Many of that we continue to speak about today. Also, CCH, we have our resource library, and there's a good amount of information on research. And the last three is what David spoke about during his presentation. There's different documents that you guys will all get when we send this to you on defining the functions of outreach, also the goals and strategies of a statewide response to unsheltered homelessness, and then also just the different roles and functions of having a outreach team. So that will be sent to you all. And next, we're going to go to questions and answers. So some of you have sent me some questions. Thank you. All right, so someone is asking if we can speak a little bit to how outreach teams have addressed the increase in encampments due to COVID-19. I think, David, you would be great to speak to that.
I can speak to this. I mean, it's a moving challenge. So I'll let you all know that, you know, CCH has been trying since March to promote the CDC's guidance to avoid clearing encampments and to offer resources to people who are staying in encampments. You know, knowing where an encampment is at some risk of getting cleared is a tough thing. We've had a couple of communities that have reached out. So I'll just first flag for you that myself, as well as Kara and Lee at Department of Housing, are good contacts. You know, if your local CAN has the capacity to respond to a risk like that, that's great. You also can alert us because we want to try to step in and be helpful. And we're supporting a couple of communities, although we have heard of instances where, you know, quickly people staying in a park were given a sort of, you know, notice by law enforcement to move along sooner than later. So we're still trying to understand where the daylight sometimes is between beat police officers and their chief, or between the chief and city hall. You know, these things all roll out a little differently from a municipality to another. I know that a couple of our communities have been able to stand up, you know, outdoor tented sites for services. I know that Mark Jenkins and Greater Hartford Harm Reduction Coalition and Journey Home together delivered porta potties and, you know, cleanliness and hand washing infrastructure to places where there are a lot of people staying outdoors. Velma George and City of New Haven had a space that they were able to put up, you know, in a temporary way to try to make sure that those kinds of amenities were available. But there's a lot more that could be done on that front. I mean, I think we will always want to be putting our problem-solving energies into reducing barriers to shelter and housing, but at the same time have to acknowledge that where there are just bottlenecks that we're not going to get through quickly, people are outside now. So, you know, it's not a statewide approach at this point, but there are some communities that have really given this some thought, and you know, just wanted to highlight what they've been able to accomplish.
Thank you. And we have a few questions about providing outreach to undocumented individuals and trying to assist them, although they're fearful that they may be deported or they don't know how the system works. How can you go about still assisting them and providing outreach and services?
If I can speak to that, I think a large part of it is truly just being able to build that trust. And part of it is being transparent, being very transparent and explaining to that person exactly how the process works, exactly what might be available to them, what you might be able to do for them. And also trying to understand what their networks and resources already are, because they may not even need to enter a shelter ever, or in of funded program in the homeless response system. There may be a way that you could assist them with staying with a family member or friend, other types of kind of shelter diversion techniques that you can utilize that they will never even have to have their name written down on anything. I think also the language helps with building that trust. So, if you speak the language and they can express themselves in a way where they feel comfortable, in a language where they feel comfortable, I think that will contribute to the whole process of establishing that trust. But I think transparency is also important, and just getting very creative with what the solutions are and having them lead that process, or helping you to really figure out what is going to work for them.
Thank you.
I don't know if you guys. Oh, go ahead. I just wasn't sure if anyone else wants to add on. I wanted to say that piece.
I would just add, talking to FQHC here, Generations in the East, you could partner with agencies that are already doing this work towards these populations, kind of definitely what Mia is speaking to. There's a lot of farm workers in Lebanon, Lisbon, down in that southeast corner. There's programs now that are and have been historically active through the area health education centers, the promotores, right? So partnering with and realizing who culturally competent folks and organizations are, and utilizing the connections that they have as well. We can't do this ourselves, and some of us sometimes we think that we're the person that can provide this, but we just might not be the one. And it's realizing when it's not you, it's another partner hopefully that's out there in the community.
Thank you, Carl. One last question. Are there different types of outreach for adults versus youth?
So you always got to think about your funder, right? We've got people who are funded to work with this population or that. In theory, it could come down to skill set or where you're housed, what agencies your resource has access to that define what population you're focused on. I'm aware that we've got a lot of part-time outreach workers where, say, what once was a full-time position got split in two and turned into two half-time positions for the guidance that, people shouldn't go out alone to do homeless outreach. And where, you might have two different kinds of positions layered on together. So sometimes you've got someone who's both a youth navigator and a path outreach worker, or, a homeless shelter worker and a SOAR benefits. So, we've got some people are working under a youth-specific contract. The PATH contracts specify that the client has to identify as having serious mental illness, which can be a barrier to PATH continuing to work with somebody after first talking to them. So that's tough. As always, navigating what your different funders want to do with their money. And we do have in Connecticut a pretty distinct workforce focused on youth, with the youth navigators especially. And Carl, you could say a lot more about that.
So I would just add, you're spot on, David. I would just add, for minors, it's a particular challenge, and we're trying to figure this out as a state. For unaccompanied homeless youth who are under 18, it's really RI providers, the runaway homeless youth providers, and there is one in West Hartford. There's a great one in New Haven. There's Kids in Crisis in Bridgeport, but they're few and far between. But they also should be, you know, regional and statewide resources for all of us to query and question and really figure out what they have available for outreach dedicated to young people, particularly minors. And I would just say that this landscape isn't getting bigger at this moment. We actually lost some funding as a state through HHS for these RI providers to do specific targeted outreach. So for minors in particular, it's a challenge. We do have McKinney-Vento liaisons that aren't, you know, dedicated. These are not outreach workers. These are folks with each school district that help homeless families and housing unstable families. It should be a resource and a point of contact for us. But to the general question of dedicated resources for youth, not a lot, and we're trying to build the system with partnerships. There's more to come from us and CCH with youth service bureaus in coordination with the Department of Children and Families. So please keep paying attention and asking these questions. It's really vital question right there.
All right. Thank you so much, Carl. We are actually going to close out here. We are over our time, so thank you for those of you all that stayed on with us. Also, this webinar is being recorded, so the webinar will be sent out to you as well as the slides. And if you have any additional questions, you can email webinar@cceh.org. As I said in the beginning, this is the first webinar of a outreach series, so more to come with that. I'm going to close out with just thanking my speakers, Carl, David, and Mia. Thank you for joining us today, and you all take care. Goodbye.
Thank you.